Cancer. What is cancer? Cancer is a disease characterized by the uncontrolled growth and spread of abnormal or mutated cells in our body. Normally, cells grow and divide and die in a controlled way. However, when the body's control mechanism stops working due to the mutation of cell DNA, cells start to divide and grow uncontrollably and form tumors. These tumors can be benign, that is non-cancerous, or malignant, that is cancerous. Malignant or cancerous tumors can invade nearby tissues and spread to other parts of the body, which can lead to death. Early detection and treatment can significantly improve the chances of survival. Some common types of cancers and their symptoms. Lung cancer. Persistent cough for more than 4 weeks that worsens over time could be a sign of lung cancer along with the coughing up of blood. Breast cancer. A lump in the breast that does not go away, especially if it is painless, could be a sign of breast cancer. Cervical cancer. Postmenopausal bleeding could be a major sign of cervical cancer. Oral cancer. A sore or irritation that doesn't go away within 2 to 3 weeks. Redness or white patches in the mouth could be a sign of oral cancer. Colorectal cancer. Changes in bowel habits, diarrhea, constipation that does not go away for a very long time, for weeks or even for months. Rectal bleeding or blood in stool could be a sign of colorectal cancer. Stomach cancer. Persistent indigestion or heartburn, loss of appetite, nausea and vomiting, sometimes with blood. Stomach pain, feeling full after eating small amounts of food, could be a sign of stomach cancer. Prostate cancer. Difficulty in urinating or weak urine stream, blood in urine or semen could be a sign of prostate cancer. Lymphoma. Recently in India, there have been a number of increase in lymphoma cases. Painless swelling of lymph nodes, often in the neck, armpits or groin. Persistent fatigue, loss of appetite or weight, shortness of breath, chest pain, abdominal pain could be a signs of lymphoma. Now let us look into some case studies. Neuroblastoma. What is neuroblastoma? Neuroblastoma is a type of cancer that begins in immature nerve cells, typically found in the adrenal glands, neck, chest, or spinal cord. It mainly affects infants and young children, usually diagnosed before the age of 5. The exact cause is unknown, but certain genetic mutations and hereditary conditions can increase the risk. In June 2022, a 19-year-old male began experiencing mild headaches that progressively worsened. Initially, he consulted an ophthalmologist, that is eye doctor, and was prescribed glasses, which temporarily relieved his headaches. However, by September of 2022, he started suffering from chronic back and leg pain. Despite seeking medical help, his symptoms persisted, and by November, he felt like a hard mass was in his right abdomen, along with pain. The pain increased, prompting him to visit Goa Medical College and Hospital. After a series of tests, including ultrasound, CT scan, biopsies, doctors discovered a tumor in his right adrenal gland. He had neuroblastoma, a rare cancer usually found in children under 5 years, with metastasis or spread to his bone, marrow, skeletal system, lymph nodes, and liver. Given the severity, his family transferred him to Tata Memorial Hospital in Mumbai. A series of tests were done, including PET scans and MIBG scans that confirmed the extent of the disease. A PICC line, that is a pipe, was inserted to administer chemotherapy directly into his central veins. He underwent 4 cycles of chemotherapy, which caused his body to swell, especially his legs, due to lymphedema. Lymphedema is caused when there is obstruction in the lymphatic system, in this case, due to cancer. He also developed symptoms like cough, cold, fever, diarrhea, and vomiting, which are some of the common side effects of chemotherapy. Due to severe weakness and weight loss, a nasogastric tube was inserted directly into his stomach to provide him with nutrition. In June 2023, 3 more chemotherapy cycles were administered, followed by surgery in July to remove 80% of the tumor. The remaining tumor was treated with radiation therapy. By December 2023, traces of neuroblastoma were detected in his spine, requiring further chemotherapy, which continued into early 2024. By February 2024, oral chemotherapy was initiated and the patient was discharged. Though the cancer had largely been controlled, minute traces of neuroblastoma were suspected to remain in some of the areas, for which he had to go to regular checkups every 15 days. Currently, the patient is healthy and has gained his appetite and normal weight and is much more better. Follicular lymphoma. What is follicular lymphoma? Follicular lymphoma is a type of cancer that affects the lymphatic system, specifically a type of white blood cell called as B lymphocyte. It is a slow growing form of lymphoma and can often go unnoticed in its early stages. A 54-year-old female began experiencing severe abdominal pain and cramps, especially in the middle of the night. The pain was severe, waking her up at around 2 to 3 am. Along with the pain, she also felt bloated, which made her very uncomfortable. She went to a local doctor who consulted her to a radiologist. There, some scans were done and free fluid was found in her abdominal and pelvic region, and mass was found in her epigastric area, which is the upper part of the stomach. To get a clear picture, she was sent in for a CT scan, which uncovered a large mass in her abdomen and thickening in parts of her stomach. Multiple enlarged lymph nodes were also found in her retroperitoneal area, the area behind the abdominal cavity, and the pleural effusion was found pressing against her right lung. Pleural effusion is when fluid accumulates in the pleural space present between the lung and the inner wall of the rib cage. The doctors suspected it could be lymphoma, a type of cancer that affects the lymphatic system. For further evaluation, she underwent a biopsy and an upper GI endoscopy at Goa Medical College and Hospital. Over the following weeks, she was admitted to the hospital multiple times for various tests and treatment. In January, a special procedure was done where a thin needle was used to take a small sample out of a lump for testing. She was sent home with some medications, but however, her symptoms persisted. By March, despite undergoing multiple ultrasounds, CT scans and biopsies, she continued to suffer from abdominal bloating, nausea and pain. In March 2022, another biopsy was done that confirmed that she had follicular lymphoma. The doctors quickly started her on chemotherapy. Her first cycle began on May 5th, 2022, and over the next several months, she underwent multiple rounds of chemo. Despite the challenges, she recovered. Follow-up scans showed significant progress. By January 2023, a PET scan revealed that cancer cells had stopped growing. The right pleural effusion had almost resolved, and the tumors in her abdomen had shrunk by 25 to 30%. By July 2023, ultrasounds showed that there was no longer any free fluid in her abdomen and everything seemed to be functioning normally. Her pain was relieved, her appetite had returned, and overall health had significantly improved. As of now, her doctors continue to monitor her every 6 months, ensuring that the cancer does not come back. Prevention. Diet. Avoiding processed food. Processed food often contains preservatives and other chemicals that are carcinogenic. Wash fruits and vegetables thoroughly. Often they are laced with pesticides and other chemicals that may cause cancer. Limit red meat and alcohol intake as both have been linked to increased risk of colorectal cancer. Lifestyle habits. Don't consume tobacco. Smoking and chewing tobacco are major risk factors for lung, oral, throat, and esophageal cancers. Do regular exercise. It helps to maintain a healthy weight and reduce cancer risk. Obesity is also linked with many cancers. Hence, regular exercise and proper diet habits must be followed to prevent cancer. HPV vaccination can prevent cervical cancer. HPV is human papilloma virus that can cause cervical cancer. Regular screening should be done as early detection of breast, cervical and colorectal cancer can significantly improve survival chances. Some screenings, vaccinations and tests to be done regularly for prevention of some common types of cancers. For prevention of breast cancer, women should do mammograms, that is breast screenings, annually or every 6 months, starting from the age of 40 through 45. To prevent cervical cancer, HPV tests can be done that check for viruses that cause cervical cancer every 5 years from ages 25 through 65. HPV vaccinations are also available. To prevent prostate cancer, men should do screening starting from the age of 50 onwards. Colorectal cancer. Colonoscopy should be done every 10 years starting from the age of 45 to 50. Lung cancer. CT scan should be done annually for high risk individuals, especially long-term smokers who recently left smoking. Lesser known causes of cancer. Pesticides on fruits and vegetables. If not washed properly, pesticides can remain on fruits and vegetables which are carcinogenic. Dishwashing soap residue in utensils. If utensils are not rinsed properly with water after washing with soap, the chemicals might remain and enter in our body to the food that was cooked in that utensil, potentially causing cancer. Certain creams and body lotions. Some skincare products contain harmful chemicals like parabens, phthalates, and formaldehyde releasing preservatives which act as endocrine disruptors and can potentially cause cancer. Makeup products. Many women nowadays like to use makeup products, but these makeup products may contain harmful chemicals that are easily absorbed through skin. Hence, prolonged use of these makeup products can increase the risk of getting cancer, mostly skin cancer. Junk foods and soft drinks. Junk foods have preservatives, artificial colors, which have been linked to cancer. Soft drinks contains high levels of sugar and artificial sweeteners like aspartame, which are linked with cancer and diabetes in young children. Air fresheners. Many air fresheners have harmful chemicals that enter our body and over time can cause cancer. Plastic containers and bottles. Plastic containers and bottles. If heated or hot substances are stored in plastic, harmful chemicals get into the food or water, which are also said to be carcinogenic.